So, unfortunately, you had a bad experience with your first COVID jab, or maybe it was with a COVID booster. Chills, fever, extreme tiredness, or maybe you got the trifecta and had all three. And so now you're thinking twice about getting a COVID booster shot. But what if I told you these are a good sign? Well, you've come to the right channel, because today I'm going to show you the evidence why these symptoms, in fact, could be beneficial to you. But even if you're not convinced that vaccines are beneficial for you, stick around to the end as I give 2 easy and highly effective tips to reduce complications from COVID-19 without needing vaccination, and applicable to any strain of COVID-19 that we're currently facing. Now, I wouldn't be a very good pharmacist if I didn't look at the current Australian Immunisation Handbook and Australian Government recommendations on booster shots. So let me pull them up here and here. Now, if we start with the Australian Immunisation Handbook here, we can see that adults aged over 75 are recommended a booster every 6 months. In the age bracket below that, between 65 to 74, a booster shot is recommended every 12 months unless there is significant benefit outweighing the risk, so potentially being immunocompromised or having underlying health conditions. Then, in the final age group, from 18 to 64 years old, it is recommended to consider having a booster shot every 12 months. Now, the key word being consider, and I know this has frustrated many healthcare professionals in that using the word consider is quite light and far from a strong recommendation, which is why now I want to look at the Australian government recommendations, where we see similar recommendation: anyone aged 75 and above should be having a booster shot every 6 months. Now, again, similar to the Australian Immunisation Handbook, those aged 65 to 74 should be having a booster shot every 12 months unless they are immunocompromised or have underlying health issues where the benefit of having a booster shot every 6 months exceeds any risk. Now, the advice for 18 to 64-year-olds who are healthy is very similar. It's recommended to have a booster shot every 12 months. One additional group that is recommended to have a booster shot every 12 months is those aged between 5 to 17 years old who are immunocompromised. Now, I don't know your personal circumstances, so I would highly recommend speaking to your doctor about whether you need a booster shot. But this is just to set the scene and give an overview of what guidelines and recommendations are out there. And if I'm to summarise both the Australian Immunisation Handbook and the Australian Government advice, it's those aged 75 and above and those who are immunocompromised are at significant risk of COVID-19 implications. But one shocking stat that I read recently is those who are living in residential aged care facilities, and only 40% of these residents are up to date with their booster shots, which is why when we peel back the hospitalizations and deaths caused by COVID-19, most of these are the elderly, the most vulnerable group, age 75 and above. And for this cohort, I would strongly recommend following the 6-monthly booster shot recommendation. But let's talk about the 18 to 64-year-olds who are recommended to consider a booster shot. And I want to show you this one extremely fascinating study. It was published in the Annals of Internal Medicine entitled COVID-19 Vaccine Side Effects and Long-Term Neutralizing Antibody Response. Now, if you're a regular on this channel, I've gone over my method in breaking down and critiquing clinical papers. So I'm going to dive straight into this. If you want to learn more about how I do that, click the video description below and I'll leave a link to that video. But otherwise, this paper was published in a reasonably peer-reviewed journal. It had 363 patients enrolled, which I'd caution is quite a small, but the results are fascinating, and that's what I want to share with you. The study showed that in this cohort, who were majority female and aged around 50 years old, after having initial side effects to their COVID shot, ranging from chills, tiredness, feeling unwell, and headache, in 6 months' time, they actually showed they had double the immune response compared to those who didn't have any side effects. So If you're someone who's had any of these side effects, maybe it's reassuring to know that actually your body is just building up more antibodies, and that is why you're feeling the symptoms you felt. Interesting counter argument is, if you've had the COVID shots and no side effects, does that mean the vaccine's not working? Now, I'm not here to throw conspiracy theories. I think this study is very fascinating and potentially reassuring for those who've had side effects and potentially dissuaded from getting a booster shot because of those side effects. And for those who have had no side effects, the benefit of continuing your booster shot far outweighs the risk of side effects because you've had no side effects. And so I would continue doing what you're doing as per the initial guidelines that we looked at together. Now, if you're finding this video on COVID vaccine boosters informative and helpful, please give the video a like, and remember to share it with your friends and family, because sharing is caring and we all need a little boost. Pun intended. Now, at this point, you might be thinking, cool story, but what else can I do to protect myself from COVID apart from getting a vaccine? Well, I've got two measures for you. Number one, it's wearing a well-fitted mask, and that's either an N95 or a P2 mask. It's well researched and studied that the surgical mask, the homemade mask, because they don't form a tight seal around your mouth, they're not going to protect you from COVID-19, which is an airborne disease. Which means, whilst washing your hands, sanitizing are all great measures for preventing your transmission of the disease, the most effective thing that you can do to protect yourself from an airborne disease is to cover up your respiratory tract, which is your nose and mouth. The other thing that you should be doing is testing. And that's not just to say testing yourself when you feel symptomatic, but test those in your household, whether it's your flatmate, your children, your parents. Knowing who actually has the virus will help you make adjustments in terms of maybe putting on a mask at home, extra sanitary measures, or keeping a social distance. And so just by doing those two things, you're going to significantly reduce your risk of getting COVID-19. Because as I said, COVID vaccine, it doesn't actually stop transmission of the disease. Rather, it reduces the severity of the disease. And as my mum used to always tell me, prevention is always better than cure. So if you can prevent getting it in the first place, you're off to a great start. Now, there is no doubt COVID-19 vaccines have been a game changer. But what if I told you there is a safe, inexpensive, and commonly used medicine that can almost half your risk of developing long COVID? Let's dive into the evidence together. Click here.